Well, thanks so much, you guys. How about those breakout sessions? You feel like those provided value and shed some light on senior issues? Well done, speakers, presenters. Thank you very much. The part you've all been waiting for. Put down the tomatoes. Those are for a snack, not for... I'm kidding. That's for me. You guys, they direct them at me. This is a really valuable time. This is a time where you can hear other questions that maybe you haven't even thought of be posed to the Home Care Services Bureau. And so thank you so much for all of you. I have a stack of questions that I consolidated onto here in addition to what you guys submitted in advance. And so, yeah, Yvonne, Jackie, you guys ready? Okay, so kind of one burning question. We've jumped through all of these hoops. We've all got licensed. We've all spent thousands of dollars and all this time, right? What about now these agencies that are skirting the law and just saying they're not going to do it? What are you doing to, what are they facing? What is the next step for them?
Okay, as spoke about this morning, we do have a complaint investigation protocol. So we do accept any type of complaints, and we anticipate unlicensed being probably the majority of the complaints that we will receive, especially in the beginning. We will be going out and investigating those unlicensed complaints. If they do not apply for license, the statute does allow us to issue a $900 a day civil penalty for those individuals that are providing home care services or arranging for home care services unlicensed. So in the beginning, we will be working with the unlicensed organization to help educate them and to see, is it just a lack of they did not know about the law, and if they will apply. Our ideal situation would be before we leave that day, they will submit an application with the Department of Social Services, or maybe it's the next day, but we do need an application, and we're going to press them, for very strict turnarounds and to try to get them into compliance. And if they choose not to be in compliance with the law and still continue to arrange or provide home care services, we do have the option of issuing civil penalties.
So kind of as a follow-up question, it's interesting, somebody who had to leave asked me to pose this. They talked to an agency who said, you know what, we're just going to absorb the fee. And they feel like they're making enough money competitively to do that sort of thing. And I just wonder, is that $900 a day, is that the maximum presently that's under statute that's allowed?
Yes, in statute is $900 per day for offering or arranging home care services unlicensed.
I can't stomach the $900 a day, but somebody out there apparently can. So when it comes to all of these changes that are going on, what are you putting in place in terms of a roadmap of educating the public, educating referral sources? Does the department have a plan in place to do this?
So yes, the department does have a plan. Part of our plan is we are doing this stakeholder engagements with the webinar, through the status calls every month. We're also meeting with other organizations. We have met with Cameron independently of this. We've met with other organizations, other entities trying to get the word out. We have also, and I know this may, we've started our internal education within the Department of Social Services. So if the complaint comes in through our centralized complaint information bureau, that they know to transfer the complaint to us. We also want our regional offices within the Community Care Licensing Division to know that this law is being implemented by the Department of Social Services, and questions that come in to the field offices come directly to us. So we're starting there. We do have plans for an outreach effort, but we wanted to get this initial wave of license done and registrations done, because we recognize without these license and registration, you can't provide the services that are needed. So, and we also know that we have been learning a lot by partnering with all of you before we go and do the outreach. But yes, we do want to have an outreach to those organizations that are not participating in these types of information sections, and then also the general public. So we do plan on doing outreach efforts but they were not delayed, they were intentionally put behind this initial wave of licensure and registration.
I want to get this initial part right before we tell everybody about it.
Correct.
You know, one thing that I know the ABHC, and when we met up in Sacramento a few months ago, is we're also a real big part of educating. ABHC wants to partner with disseminating whatever information and educating our community resources about what the licensure entails. And so we're going to be working closely, and if any of you have an idea or if you have something that is in place in terms of some sort of flyer or some sort of information that summarizes some of this stuff, let us know, because we'd like to have that be what our membership takes out and uses to educate. You know, when it comes to partnering with you guys, something also, many of you had questions, if I might jump in terms of what happens when there is an agency who is, what do we do, how do we, and I know that you have a hotline. We've also, ABHC has created a reporting tool that we're using to allow you to anonymously submit people, agencies that you believe might be operating outside of the law. I'm going to summarize this. When we met, my question was, why aren't you going after these other agencies? And something that Macaulay mentioned to me was that you don't always know, just based on the name, what the nature of a business is. Maybe it says home care, but it's a home health. You can't just opening up the phone book in Sacramento know what somebody in Orange County is doing necessarily. And so that's really where it comes down to us. Would you think, do you say that that's probably pretty accurate?
Yes, I mean, we are relying on all of you to also help us identify those unlicensed home care organizations, because I think it's a mutual thing, is we want to bring all the home care organizations into compliance with the statute. And we can't be everywhere and knowing everything that's happening in the industry. So yes, we are hoping that all of you will work with us and identify those organizations that you feel are unlicensed, and then allow us to implement our protocols to address those issues.
Now, you mentioned earlier during your talk that unannounced surveys may begin starting in 2017. Is that what you're anticipating? Okay, early 2017. So no dilly-dally, you guys. Make sure it's all in line. I want to also, you mentioned, you used the word technical assistance a couple of times, a few times. In plain speak, right, that I'm hearing that as being, you're going to come in with a posture not of coming to shut anybody down, but to come alongside agencies and to offer assistance to help us to get in compliance with the law. Is that essentially what?
Yes, that is exactly what we want. We are not coming in with a little red clipboard to post a sign saying you're closed down. We're coming in to look at the records to say, okay, why do you have it this way? Because maybe our written directives aren't going to work. You know, we've received feedback, we've talked to organizations, but maybe we didn't get something right. Maybe we can expand something to accommodate more different styles of the organization. So yes, the technical assistance is definitely, we want to partner with you. We want to help to bring you into compliance. Now, again, this technical assistance period may end, but for right now, we are definitely in technical assistance mode. We want to help all of you to come into compliance and to identify. We're using this also as we have written directives, and eventually we will have to promulgate regulations. And by working with all of you now, we're hoping to be able to produce a regulation package that none of you will object to, and it will just sail right through the regulation process, because we have this partnership, this technical assistance now, and we got it right, and everybody's had their voice in it. We all may not like it, but we understand why it has to be this way or that way, and it'll be an easier process in years to come, and now also.
I think that provides me with a lot of reassurance, you know, knowing that you're working with us as we try to navigate this very new thing. So the question is, when they come in, if there's a separate registry file and a human resources file, are you taking all of it, or what do you anticipate taking out? What do you want access to?
So I want to clarify, we are not guaranteed to take your records out. If we find there's a need to remove the records for copying purposes, we may do that. But that is not a guarantee. That's not part of our protocol, that we're going to come in and wipe your office of all your records and ship them back to you in a couple days. That's not what we, envision doing. We have the right to inspect your administrative records. So it's difficult for me to say your registry file versus your HR file because another organization could call them something else. So we have the right to inspect the records involving your application, your licensure application, your home care aid, your home care aides, your employees, the licensees, everything but the personal health information of the clients. So we could look at all administrative type records, and that does include HR. It does include employment records, but again, it's difficult to say that we will definitely look at your registry records when your registry records may be something different. It would be a case by case, and hopefully by the time the visit happens, you will have had a conversation with your analyst at least once. You will have a strong feeling of, if you have any questions, if you want to talk about would your registry records need to be made available, I would encourage you to call your analyst, talk with your analyst, explain to your analyst what you define your registry files as being, and then let us have that conversation before. That way when we go out, you're ready, we're ready, and it's an easy process.
It would probably be safe to say that you are definitely responsible for anything that's written in the directives is definitely going to be something that they can take. And it sounds like every case might be different. Yours could be different than theirs, could be different than mine. So talk to your analyst, right? Kind of a follow-up on that is, what about when we've got computerized systems? We've got some physical files, but what about the things that like our scheduling software and the different staffing things that we use? What kind of access do you anticipate requiring for that?
Okay, so in the written directives, Article 2, Section 1, General, Subdivision B, does state that all records have to be in hard copy. As we get out, and if part of our learning process, if there is some standard software that many HCOs use, and we can learn it and you want to give access to us, we may be able to do that. But for the initial site visits, I would recommend that you're prepared with hard copies. If you are going through the site visit and you hypothetically did not print your training report, hopefully the relationship will be there that the analyst will be able to say, I see it on the screen, I need you to print it out. Or I've seen it on the screen, you've logged in, you've shown me, I don't need you to print it out. But the written directives does say hard copies must be made available, but that doesn't mean I want you to all go back and print everything that's in your system. If you have questions, you have lots of data in your system and you're just not sure, again, call your analyst, talk with them, and let's work it out before we start scheduling the visit so you're ready and we're ready.
It sounds like you're wanting the analyst to be really the first phone call and the first point of contact, as opposed to just calling the customer service number. Ideally, these are people who are going to know us and be able to respond specifically to what they know to be true about us. Is that right?
Yes.
Any final things? I know you guys have to make a plane, and so I want to respect that. I really appreciate your graciousness in being here and answering these questions with us. Are they fast? Fast. For those who maybe are further back, the question or comment is, whereas in the original directives it said that we had to include the license number on all of the marketing material, that has been revised in the most recent directives to read, it may be included in the marketing material. Can you speak to that?
So I will definitely go back and do a little bit more research, but the intent of the revision was you have marketing materials on your pen, your pencil. It does not need to be on a pencil, your license number. So if we revise the written directive in a way that your primary source of marketing for your organization, which I would believe would not be a pen or a pencil, should have your license number. So we will definitely go back and look at that. With that, so thank you for that. We do anticipate a version 4 of the written directives to be released. We're hoping in the next 60 days, but it could be as late as the end of the year. And so with this, if we need to revise that, we will also include that. But the intent was, again, you don't need to have your license number on a pencil or a pen. That was the intent.
Hey, Cameron, this is our last question.
Last question there.
Sorry.
So now that you seem to have a safer microphone, with respect to education. So in terms of, so my question is kind of twofold. In the meantime and in the future. In the meantime, can we have something simple, like possible to have like something where there's a simple, flyer or communication directed to consumers that says why you need to have a licensed agency and how they can verify if the agency they want to use or are using is licensed. And then the second fold is in the future, once you go through the wave of licensing and can kind of focus on that a little bit more, what ways are you thinking about? Is it radio, print? How are you going to reach the consumers and, in terms of educating them about this?
So we did, in the very beginning, what seems like years ago, but it was just a year ago, put out a fact sheet, just home care services, what law implemented, what are home care aid, what is a home care organization, what type of services. So we will definitely go back and look at revising that because we've come a long ways. And we will definitely look at revising that for the consumer perspective or maybe putting out a consumer perspective fact sheet. So yes, we can definitely look at that. And in relation to your other questions about our outreach, we have explored lots of different outreach options. Macaulay and I have participated in 2 podcasts and have another one scheduled. We spoke with AARP about how we could use them to disseminate the information. So if you have any suggestions on how we might be able to reach the consumer and help them understand what does that home care license status mean versus someone who doesn't have that license, we would love to hear that information from all of you. But we are looking into what type of outreach would be best for the home care associations, home care organizations, that have not yet come forward for licensure, for the home care aides that don't understand the difference, and the consumer. So we are trying to identify the different outreach efforts that we can make.